So no sleep. How many of you are on Twitchy Woman? How many of you subscribe to Twitchy Woman? 1. I know there's 2. I know there's more than that. Why aren't the rest of you on it? Okay. No excuses. Okay, it's up there. Okay, www.twitchywoman.com is me, and can I turn this? It seems like it's echoing. It's okay? Okay. I'm very happy to be here with you today. I want to thank you. Sharon, who does read my blog, is the one who recommended me. Sharon, good name, as you said. Thank you. She encouraged the conference chairs to invite me here today, and I'm thrilled. And I've been asked to speak to you about advocacy. And there's a lot of different meanings for advocacy, but we will start here. Oops. I got to figure this thing out. I can never figure this out. Okay. Is there... You just... Oh, the down button. Okay. Oops, what did I do? Okay, blame it on the Parkinson's. Okay, here's a quote from a very brilliant American philosopher. Unless someone like you cares an awful lot, a whole awful lot, nothing is going to get better. It's not. And that philosopher is Dr. Seuss. This is from the Lorax. And I'm looking at this, and it reminds me that I wanted to have you stretch just a little. I can't do what Jennifer did, but let's just up and down and up and down, because you're sitting for a long time again. Okay. Feel better? Okay, you can keep doing it as long as you want. Okay. So I'm going to talk about my story first and how I got here, and we'll talk a lot about advocacy. So did your road to diagnosis look like this one? Easy, right? Or this? No? How about somewhere in the middle? Yeah, that's what my story looks like. So almost 12 years ago, I started to notice some odd things. One day I was writing at my desk. I'm writing and my foot's going like this. I said, okay, that's weird. I stop, relax, shake my hand out, and I go back to writing, and it's okay. And then it happens again. I'm writing and I'm going like this. And it happens 3 or 4 times and it goes away. Then I broke my leg, my other leg, walking my dogs, who decided to chase the cat that came out from across the street, pulled me down, and there I went. And the tremor came back big time. So I went to my doctor, my internist, come in on my crutches and my cast and the whole thing. And he looks at me and he says, well, let's try some Xanax. Didn't help my foot, but I sure did feel good. It really helped a lot. Whoops, I didn't want to do that. So he sent me to a neurologist in January of, what year is this? 2009. But in December of 2009, I was diagnosed with barely there breast cancer, like barely stage 1. So the week I saw the neurologist, I was going to have surgery later that week for that barely there breast cancer. So I don't know if he was trying to be nice. He looks at me, does the usual things, tap your fingers, do this, walk down the hall. And he says, oh, you have a Parkinson's-like tremor. I don't know if he was trying to be nice because I was going through this other thing. I don't know. So he gives me medication, sends me home, no information, no nothing. I go in, I have my surgery, I have 6 weeks of radiation, and I slept for 5 months. When I woke up, what did I do? I called my internist and I said, I don't like this doctor. He put me on Requip and kept increasing it so fast that I actually had hallucinations when I was trying to sleep one night out of town. So he said, stop taking the Requip, I'm sending you to a movement disorder specialist. Why didn't you send me there in the first place? Big question. And this is something you have to advocate for yourself. And I understand it's a problem here in Fresno, but if you can go to the clinics in San Francisco once in a while and do telemedicine, go for it, because it really makes a difference. So I finally saw a movement disorder specialist at UCLA, and she says, you have Parkinson's. And she She gave me some information, some websites, and said, here's some medication, come back in 3 months, which is better than most. Most give you medication, say come back in 6 months, and they'll talk to you then. And so where am I? Total shock, right? How many of you were in shock when you got the diagnosis? Okay? You go home, you think about it, what is going on here? Now, 10.5 years ago, I found one blog, a couple of websites, that was it. So I went back to bed. What did I do when I found this out? Nothing. Okay? Well, almost nothing. I did a little bit of reading on the internet. I started finding some books on Parkinson's, like Parkinson's for Dummies and that kind of thing. I learned a few things, not much else. I went through the stages of grief like everyone else. And I just wanted to stay in bed and eat chocolate. This is from one of my early blog posts called It's My Pity Party and I'll Cry If I Want to. So here, my road to diagnosis and recovery. First of all, you got to find the right doctor. This is somebody you're going to have a long-term relationship with, whether you like it or not. If you don't like the doctor, find somebody you do. Somebody you can talk to. Really important. Support. One blogger calls her support team her wolf pack. That's the Perky Parky, if you've ever read her. You need a support team. I had one friend with Parkinson's who was diagnosed the same time I was. So the two of us were a support group of 2. It worked. Worked as long as we needed it to. My husband and the few friends I told that I had Parkinson's, because I couldn't say it. It was really easy to say I had breast cancer. Parkinson's? No. What is our image of Parkinson's? So I said, I was hiding it. But I had to learn. I had to read about it. I became a compulsive researcher. I read everything I could find. There wasn't much out there, but I read it. And I was lost. It took me almost 5 years before I was willing to go to any event like this. The first one I went to was a Fox Foundation event in Los Angeles. I think it was 5 years ago, 6 years ago. And in the meantime, I'm trying to hide my tremor, which my friend, my support group of 2, we look at other people and go, do you think that person has Parkinson's doing hand-holding thing? You know the hand-holding thing? I was doing the hand-holding thing for a long time. And I was in the public eye and I was going to speak. And if I had a podium, it was okay because I could shake behind the podium. But when you don't have a podium, what do? Right? So, especially if you have papers in your hand and it's flying all over the place. So, anyway, I was totally lost. And UCLA hired a therapist named Eric. And I am forever indebted to Eric. I'm supposed to go for a year. I've been going for 6. At one point, he said to me, I want you to write your narrative. Write your Parkinson's story. I said, I don't like to write. He said, do it anyway. I started writing and I couldn't stop. Over 3,000 words later, I finished, sort of. I sent it to him. He's the only person who's ever seen it. My husband has not seen it. My friends have not seen it. My children have not seen it. It's very private, but it's my story, and I learned a lot about myself writing my story. So this was an important part of my recovery, because once you you put your story down and you understand what's going on with yourself, you can accept it in terms that you couldn't before. So now it was the time to get on with my life in a meaningful way. This is 5 years after diagnosis. And being someone who's always had a very active life in local organizations, I wasn't long it didn't take me long to get myself back into things. And I was getting phone calls from people, can you talk to my brother-in-law? Can you talk to my friend, my cousin, my relative? They were just diagnosed. Now, I hadn't come out. Nobody was supposed to know that I had Parkinson's. How did they know this? So I said, maybe I should write down what I'm telling them, and I can put it out in a blog post and be done with it. So I started my blog. And that was my first step towards advocacy. And by the way, the fact that you're here today, this is a step towards advocacy, because you're learning how to take control of your life, of your Parkinson's. And that's what I was going to do. I was going to take back control. So when you think of advocacy, is this what it means to you? Going to Sacramento or Washington? That's what most people think of, right? Or does it mean this? Or is it both? What do you think? Both. And for us, for those of us with Parkinson's, we need to look at both. But we're going to start with self-advocacy. So what is the first thing that you should do? I just told you. Write your story. Why? You need to know your story before you can talk to anybody else about it. Before you can tell them what you need, what you want. You can use this as a way to better understand your condition, and it often clarifies what your needs are. Okay? And it provides a type of healing that drugs don't. So what are you going to do with this? And I've got a problem here, because I can't read the notes on the thing here. Hold on. Okay, oh, here we go. I'm just trying to get my notes here, but it's not working. Okay. There we go. Okay. So what you want to do, whether you're meeting with another person with Parkinson's, you're meeting with your doctor, you're meeting with a legislator, is you want to know what your story is and be able to communicate it with them, whatever is relevant. Once you have that, you're ready to advocate. So we're going to talk about advocacy in 3 different ways. The first is for yourself. The second is for others with Parkinson's disease. And the third is for the Parkinson's community at large. That may not be something that you want to do, although if you want to go up the road to Sacramento and lobby, that's helping everybody in the community. Okay, so let's start with ourselves. As a patient with Parkinson's disease, you need to be prepared when you see your doctor. This is a good place to share relevant parts of your story, especially if you're seeing a new doctor. They want to know your history. You've got it, you've written it, you know it, okay? You own it. So make a list of anything that you're concerned about. If you don't make the list, you know what's going to happen. You're going to walk out of the office and go, oh shoot, I forgot to ask him that question, right? Even when I write it down, I forget to ask questions. List every medication and supplement you're taking. Don't be afraid to ask questions about anything that may be related to Parkinson's. And take someone to see with you. If you cannot talk for yourself, if you can't ask questions, bring someone with you who can help you. Oops. I'll try to get some. There we go. Come on, why aren't you working? Oops, did it again. Okay. Yeah, I just want to be able to zoom down. Just scroll down there. I did it before. Where'd it go? All right, well, I can find it. I'll figure it out. So if you cannot talk for yourself, bring someone with you, whether it's a care partner, your husband, your children, your mother, your father, a friend, whomever it is, somebody there to ask the questions for you. Or just bring someone there with you as a backup, because they may understand what you don't understand, and you can talk about it afterwards with them. It's really important. So there was one, oh shoot. Okay. Wait a minute. Okay, so these are my 4 reasons to live life fully with Parkinson's. So you need to be able to advocate with your family. I have 4 grandchildren, 2 in Chicago, 2 in LA where I live. So we're constantly going back and forth to Chicago, and it's exhausting, but I wouldn't miss them for anything. And, sometimes when my oldest granddaughter was born, she's 6 and a half, I was not on any medication yet, so I was afraid to hold her because I was so shaky. And fortunately, I haven't had that problem since I went on medication. So, but you have, what are your reasons to live life fully with PD? Your family is, that should be number one. Talk to your family about Parkinson's, how it affects you, what they can expect in the future. What can they do to support you? Do they want to go to the doctor with you? My daughter in Chicago said to me, my other two daughters ever gone to the doctor with me, and I said I never thought to ask them. I came home and I asked them, and one of them went with me my next visit, and she was glad I asked. We're so used to taking care of ourselves, and this is one of the things that came out in the women in PD studies, that women who are nurturers are often taking care of someone else while they have Parkinson's, and they don't think to bring anybody to help them. And I was independent, I did everything myself, so why should I ask them? My husband came with me once a year, whether he wanted to or not, and that was the end of it. So now my daughter goes occasionally. Talk to them about what your needs at home are. Do you need accommodations at home? When you travel, do you need to take walking sticks with you? Do you need to have a walker? Whatever it may be, okay? So you also want to advocate at work for yourself. And if you're still working, have you spoken to your boss about having Parkinson's? And again, this is a good place to use your story because you can talk about what's relevant to your job. You know now what you can take from your story and use in your favor when you go to speak to your boss. Do you need accommodations at work? What are your rights? Do you want to go on disability? Be prepared with the right information. So now we're going to go and advocate in our community, and that's what you're doing today. You're out here learning, and hopefully you're going to go home and share this with other people in your community. So, first thing you can do is how I got started, and that is become a mentor to someone who's newly diagnosed. If you're up to it, you may not be up to it. I met for coffee with I don't know how many people in LA, and on the phone with people from around the country because they're friends of mine or whatever. And it's hard to mentor someone out of your city. It really is, because you don't know what resources are available. And often I would say to them, here's somebody that you can talk to if I knew somebody in the city. But in LA, these people, I met them for coffee. I had no idea what to expect, and we became best friends. And because I had my story, I could say to them, this is how I cope with it. You are not alone. I am here to help you. That's probably one of the best things you can do to be an advocate, as a Parkinson's advocate, is to help someone else. Help them get through this. They are not alone. The next thing you can do is get involved with local Parkinson's groups, which you all are, and you have your moving day coming up in April, I saw. Form a team. Bring your friends. They'll learn a whole lot when they come. It's not just walking. You see all these vendors, all these people showing their information. They're going to learn about Parkinson's when they come there. It's a great way to be an advocate, is to get other people to learn about it. In April, which is Parkinson's Awareness Month, write an article about living with Parkinson's for your local paper. Anybody interested? Okay. And share your advocacy activities at your support groups. Are you mentoring someone new? Talk about it. What's the experience been like for you? Can you encourage somebody else to do that with, maybe come along with you? There's lots of things you can do. Okay? Next is getting out into the bigger community, and that's advocating for others with Parkinson's disease. And I'm not talking locally, I'm talking globally. So you can become an advocate for the Parkinson's Foundation or any other Parkinson's organization you're involved in. They often do trainings. They train you with if you're going to go do lobbying in Sacramento or in DC, they will teach you how to speak to your congressperson, what to talk about. They will train you in advocacy. You can write to your congressperson to support any legislation related to Parkinson's research. And again, this is where your story comes in. Is Congress going to designate more funds for Parkinson's research? This is why I care. You know, I have Parkinson's. This is my story. This is why I need you to vote. You know, to vote for this legislation. Maybe your drug costs are going up, and you want them to do something about it. That's advocating. Did you know that there is a Parkinson's caucus in Congress? How many of you knew that? 2. Okay. If you go online and you look up Parkinson's caucus in Congress, they have a list of the representatives who have signed on. If your representative is not on that list, call his office, write her, whatever it takes, and say, will you please join the Parkinson's caucus? And this is why, and you go back to your story. Okay? As soon as I found out about it, I went online, found out that my congressman, Ted Lieu, was in the caucus, and I wrote him a thank you, and he responded. So, just establish a relationship. And is the next one coming up? Go to Washington to advocate for Parkinson's. I think in the fall every year, a bunch of the Parkinson's organizations get together and they send people. If you are interested in going to this day on the Hill for Parkinson's, they should contact Sarah. Yeah, contact Sarah, and she will she'll talk to you about it. I think you have to submit names, correct?
Yeah, it's an application process, but we send usually over 60 to 75 advocates to Washington to advocate for Parkinson's research funding and lift up Medicaid spending caps and physical therapy, access to physical therapy. So if you're interested, let me know.
Okay, so I don't know if you heard, Parkinson's Foundation sends 60 to 70 people every year, and it's an application process. Davis Finney sends people, Fox Foundation, Brian Grant Foundation, I think there's a few others. So if you're interested, talk to one of us, and we'll get you hooked up with somebody so you can go. It's really a fabulous experience, and I haven't had the chance to do it for Parkinson's yet. I've been to Washington for other things, but not that. In fact, I'm going next week for something else. So, then there's the World Parkinson's Congress. Did anybody go to Japan? Only me? Anybody go to Portland 3 years ago? Nobody. Okay. Well, brush up on your Spanish and go to Barcelona. The World Parkinson's Congress happens every 3 years, and it is doctors, scientists, researchers, therapists, patients. You can go to whatever session you want to. It is a great place to learn, to meet other people with Parkinson's, to be at a round table with a doctor, a researcher, and you can sit and ask them questions. It's an amazing, amazing experience. And then you come back and you tell everybody how wonderful it was, and they have to go the next time. Which will... What? 2 minutes, sorry. 2 minutes. Oh, okay, all right, I'm almost done. Okay. So you'll come home so jazzed. It's a wonderful time. I had so much fun. And if you want to learn about it, go to my blog. You'll read about it. Okay, a few more things you can do. Did you know that most clinical trials are not completed because they cannot recruit enough people to participate? You know that? See this ugly watch I'm wearing? This is a clinical trial. I'm in 1 week every 3 months I have to wear this ugly thing. So where can you find these trials? Go to the Fox Foundation Trial Finder, NIH, National Institute of Health, and I just read about it. You ask your doctor. There are Facebook groups. Oh, there's the clinical trials, and then we have Facebook groups. There's a lot of them out there. Find a couple that resonate with you, because there are many specific ones. There are some for specific exercise. There's some for research. There's some for, I don't know, women only. Find a couple that you like, sign on, and take part in it. Become knowledgeable and become part of the conversation. You'll learn a lot from these groups. But watch out for the ones who are trying to sell you a cure, because they are not being honest. You don't want anything to do with those. And the next thing you can do is subscribe to a Parkinson's newsletter. There's Parkinson's News Today, which comes out daily and has lots and lots of information on the latest drugs, therapies, blogs, all kinds of things. And a few more things. You can find a few good blogs to follow. The same rules apply as for Facebook. Find some blogs that you like and follow them. Don't do 20 of them. When I was started, there was one. When I was diagnosed, now there must be 150. And not all of them are good, believe me. So find a few, Google Parkinson's blogs. Mine will come up pretty quick because I've been out there for a while. But you'll find a lot of them listed, and there are lists of the top Parkinson's blogs. There's about 6 or 7 different ones. And if you go to them, and you can find it on my site, but if you go to them, you'll see some of the same names over and over again. And those are the ones you can really trust. And of course, there's my blog, which I'm going to do a shameless plug for it because I want more readers. It doesn't cost you anything, really. I'm not selling anything. I have no cure. And then just keep learning as much as you can because knowledge is what's going to help you be the best advocate you can. Know what's out there. If you go into your doctor and you have information about a drug that you're curious about or a treatment you're curious about, you can talk to them intelligently about it. If you watch the commercials in early morning TV and they're scary, you may want to stay away from them. But and then they do that little disclaimer, super fast speed that you can't understand. But if you want to ask about a drug, do your research before you go to the doctor. Know about it. Learn about it. So your next steps. When you go home today, share something you learned today with other people. Your spouse, your children, a friend. Set some goals for yourself. For advocacy. What is your first goal? Write your story. Yeah, I heard that. You were listening. Focus on your own care first. These are for your goals. Do you want to reach out to others in your community? Do you want to reach out farther than your community? How are you going to do this? Think about it. And finally, stay informed. As I said, just keep on reading. If you have questions, you can always shoot me an email, and I will be happy to try and answer it, at least from a patient's point of view. I don't give medical advice. I will say that I do not give medical advice. There's a disclaimer on my site. People have asked me, and I say to them, I can't answer you. So I want to thank you for inviting me to speak today. If you want any information about writing your story, I did some research on this before I came today. I'm hoping to put together something cohesive that I will post on my blog site, my website, and or if you want, I can send it directly to you. Just shoot me an email. Thank you.